I work in Brady Opticians. I meet people from all age groups, and particularly the elderly, the people say above the age of 70 and 80 years of age. They come in and quite a lot of them are anxious about their sight. They may have noticed their sight deteriorating, and they often prompt me the question, have I got cataracts? And quite frankly, quite a few of them do. First of all, cataract is where a little lens inside your eye clouds over. This is a natural aging process of the eye. I always stress to the patients here that it's not a sign of ill health, it's the natural aging. It can often be quite slow. Now, however, in some people, believe it or not, it can be quite fast growing. It normally appears in your 70s. However, in some people it appears in the 50s, some in their 60s, and some it doesn't appear at all. Years ago, the theory used to be that you could only have the cataract removed if it was mature, or to use the term, if it was ripe. Now, that is no longer the case now. The criteria for having your cataract removed is whenever it sort of interferes with your lifestyle. So, for instance, if you are a driver and your sight is affecting your ability to drive, or as opticians here, we would often see that their sight has fallen below the standard for driving, and hence then that would be a prompt for us to mention the idea of having the cataracts removed. However, it's not always the prime reason if they're a driver. If, for instance, they live alone, or if, for instance, they care for a partner or a sibling or whatever, and they're totally dependent on the sight to manage everyday tasks, well, therefore that would be another reason for referring them early to have the cataracts off. On the other hand, we regularly meet people who are quite content in their 70s or 80s and the cataracts are mature, and they would tell us that they're happy the way the vision is. They would tell us they can see the television, they can cook and do their bits and pieces around the house, and they're happy. So for those people, we would say, look, there's no need. Just come into us every year and we'll keep a check on it. Then the other criteria for referring patients is, myself and my colleague Ashley, who works alongside me, is we always check the lining at the back of the eye. As you can imagine, as we get older, there's obviously changes happening there, and the outcome of a cataract surgery is heavily dependent on the health of the lining at the back of your eye. So before we refer the patient on, we'd obviously check that that's okay, and the majority of them are healthy, and then we can say to them, look, the prognosis for a positive outcome is good here. However, from time to time, we do come across patients who have got age-related changes to the lining at the back, and for those people, we kind of have to guard them, prepare them that maybe the outcome may not be what they wanted. The symptoms of cataract is where the vision becomes quite cloudy, and people would often say, look, I feel as if I have to clean my glasses quite a lot, or I often describe it as looking through a dirty pane of glass. Their vision is a wee bit muggy and unclear, or looking through a dirty windscreen is a good example. So that's the classic sign of, or classic symptom of a patient developing cataracts. Now, when we discover or we discuss that someone has a cataract, and then we have to arrange a referral for them to be seen to have it removed. Now, we're very fortunate in Brady Opticians and in Donegal that we refer all our patients directly to Sligo General Hospital. The principal surgeon or ophthalmologist there who does these operations is a gentleman called Mr. Paul Mullaney, who we think his work is excellent. Now, even though we often say to people, look, you've got a cataract and we think you should consider having it removed, the final decision on having the cataract removed is with the specialist in the hospital. It's not really for us to say definitely yes or no. As optometrists and Brady Opticians, we act as a screen or a filter, and we would send those patients through who we think would benefit having cataract surgery. However, it's important to remember that the final decision rests with the consultant ophthalmologist in the hospital.